Assalamu alaikum. Good morning, ladies and gentlemen. My name is Dr. Mohammed Khogalee. It's a pleasure to represent this our study about association between vascular axis, intradialytic weight gain, and intradialytic hypertension in maintenance hemodialysis. First of all, I would like to thank my colleagues, Dr. Sarah Amin and Dr. Sami Mohammed, for their kind contributions and guidance to prepare this study. There is no disclosure. I would like first to give a brief hint about the background of this phenomena, which is intradialytic hypertension, which is briefly increase of the blood pressure, systolic blood pressure during hemodialysis, 10 millimeter mercury and more from beginning of dialysis at the end of the dialysis. We consider it positive if the patient developed four out of 6 sessions increase of blood pressure during hemodialysis. This phenomena actually is attributed to many risk factors, but the most important risk factor and the two major risk factors is increase of extracellular volume, which lead to increase of intradialytic weight gain. And the second risk factor is vascular axis used for hemodialysis, specifically hemodialysis catheter. And actually this phenomena is associated with high mortality and morbidity in patients in hemodialysis patient. And as we see that there is no well-established studies about this phenomena. And even the KDIGO guidelines mentions it in controversial conference, not in the formal KDIGO. Therefore, we need to look for this phenomena. And unfortunately, there is even in our regions here, there is no studies, no more studies about this phenomena. Therefore, we encourage to do this study to look for the prevalence of this phenomena of intradialytic hypertension and to evaluate the major risk factor, which is intradialytic weight gain and the vascular axis used for hemodialysis and their association with this phenomena. We did this research in the tertiary hemodialysis center within 3 months from October 2016 to January 2017. We have a certain inclusion criteria, patient with regular hemodialysis for 3 months and more, and stable patients. We excluded recently hospitalized patient, incomplete blood pressure record, or patient who developed acute kidney injury. We took the reading over 6 consecutive hemodialysis sessions. We checked the blood pressure before and after hemodialysis and during hemodialysis, and we measured the body weight of the patients before and after hemodialysis to look for intradialytic weight gain. And also we check the parameters such as ultrafiltration rate and vascular. We mentioned the vascular axis in addition to comorbidities and the medications. We define the patient who developed 10 millimeter mercury and more systolic blood pressure in 4 sessions out of 6 as the case of intradialytic hypertension. And this is the diagram conclude what we did. And we reached to 89 patients. Most the 56% of the patients were male. The mean age is 46, and 9% of those patients have hemodialysis catheter. And we reached a conclusion that the preference that is 29%, which is roughly near to what was published in certain papers and research, although there is a variable prevalence among the studies. As we see here, there is we didn't find an association between intradialytic weight gain and intradialytic hypertension. But still there is some studies related the intradialytic weight gain with the blood pressure, and it considered as a marker of poor nutrition and survivor as a marker of survivor in hemodialysis patient. Remarkably and strikingly, we found that there is a significant relation with the vascular axis, specifically hemodialysis catheter. 27% of the group who of intradialytic hypertension has hemodialysis catheter, but 2% they have AV fistula. And that is, although it is the AV fistula is one of the recommended approach, the vascular access of choice for hemodialysis patient, still KDIGO guidelines highlight that the choosing of the vascular access depend on the patient risk factors and the stability of the patient in the last update that we've seen here. This is what we are found, 27% of the patient with a hemodialysis catheter develop antidiuretic hypertension, and still the AV maintenance using of the placement of the AV fistula is the best vascular access for hemodialysis. Our conclusion due to sake of time that 1/3 of our patients develop antidiuretic hypertension. We didn't find any association with intradiuretic weight gain. It is strongly associated with the catheter type, hemodialysis catheter, and we favor early AV fistula creation for the patient. Thank you very much for your attention.
Thank you.